She's playing doctor because she couldn't hack real medicine. That is what Dr. Caldwell said 43 minutes before the boy in room 347 stopped breathing. St. Michael's Hospital in Houston smells like antiseptic and floor wax under fluorescent lights that hum at 60 Hz. Natalie Hayes moves through the pediatric wing with economical steps, her scrubs hanging loose on a frame that carries tension in the shoulders like a coiled spring beneath cloth. She keeps a pair of worn combat boots in her locker, leather cracked and stained with marja dust, though no one at St. Michael's has ever asked why a trauma nurse in the pediatric unit owns desert warfare footwear. Her hands don't shake when she starts fours on screaming toddlers, and the other nurses have learned not to ask questions about the way she can sink a line in one stick even when the veins are rolling like snakes beneath paper-thin skin. They've learned, instead, to watch her. To see how she moves through crisis the way other people breathe, automatic, relentless, without hesitation. For 18 years Natalie has walked these corridors, healing the broken and holding the dying, and not once has anyone asked her real name. This morning, Dr. Marcus Caldwell arrived at 6:44 a.m. He's the hospital's chief of surgery, 52 years old, surgeon's ego the size of a Dallas penthouse, and he walks through the pediatric wing like he owns the air inside it. His shoes cost more than Natalie makes in a month. He wears a Rolex that catches light like a small sun on his wrist. He does not notice her. Men like Caldwell have trained themselves to see only what threatens them or flatters them, and Natalie is neither. She is a nurse. She is furniture. She is background noise. At 7:14 a.m., General Marine Morrison's 8-year-old son Daniel arrives in room 347 with post-surgical complications that have terrified every specialist in Houston. The boy is deaf since birth, recently fitted with bilateral cochlear implants that should have restored his hearing, should have opened a door that was closed from the moment he took his first breath. Instead, his surgical sites are inflamed. The swelling hasn't resolved in 14 days. 2 of the 3 implants are showing signs of rejection. 3 separate ENT specialists have reviewed his chart, backed away, and cited liability concerns. Too complex. Too much risk. Not our protocol. General Morrison made phone calls. The kind of phone calls that military officers make when their children are suffering and medicine is failing them. St. Michael's offered him Dr. Caldwell. The best we have, they said. The reputation, they said. What they didn't say was that Caldwell inflates surgical codes. What they didn't say was that he splits kickbacks with an insurance adjuster named Patricia Vance who processes his claims in 48 hours instead of the standard 45 days, a 3-day premium for which she receives $4,800 in unmarked payments routed through a medical supply company that doesn't actually supply anything. Natalie doesn't know this yet. Not consciously. But her hands know it. Her hands have held together Marines with sucking chest wounds. Her hands have performed direct cardiac massage through an open chest while medevac helicopters screamed overhead. Her hands remember things her voice has been trained to forget. She walks into room 347 at 7:23 a.m., and Daniel Morrison is sitting rigid in his hospital bed, shoulders hunched like he's trying to fold himself into origami. The boy wears a hospital gown that swallows him. His dark hair is matted with sweat. Both sides of his head are wrapped in surgical bandages that no longer look clinical, they look like a cage. Natalie pulls up a chair and sits. She doesn't introduce herself. She doesn't explain protocols or timelines or the surgical reality of cochlear complications in pediatric patients. She sits. The chair makes a soft metallic scrape against the tile. She waits for his eyes to find her. When they do, she raises her right hand, palm flat, and taps her chest once with 2 fingers. A gesture learned from 7 minutes of YouTube at midnight when she couldn't sleep. The ASL sign for friend. The boy's body doesn't relax, but his breathing slows. It's small. It's not much. But it's something. Grand rounds happen at 8:08 a.m. in the main conference room on the 3rd floor. 12 residents, 4 attending physicians, 2 surgical fellows, and Dr. Caldwell standing at the head of a polished table like a captain on a bridge. Natalie isn't supposed to be there. Grand rounds is physician territory. But she's been asked to present Daniel Morrison's vitals and post-operative observations because the attending physician, Dr. Sarah Chen, respects her documentation. Dr. Chen is the kind of doctor who reads every word that nurses write, the kind who understands that the people checking vitals every 4 hours see things that consultants miss in a single 5-minute review. Natalie stands in the corner, holding Daniel's chart. Caldwell is already talking when she enters. His voice has the particular timbre of a man accustomed to being listened to, a voice like a tank idling in a garage, all contain power and the promise of forward movement. He's discussing the surgical approach to pediatric cochlear implant revision, speaking with precision about angles and insertion depth and ossicular chain assessment. For the first 3 minutes, he sounds competent. For the first 3 minutes, he sounds like a man who should be trusted with a child's hearing. Then he sees Natalie's chart. He holds it up. This, he says, and his voice changes, flattens, becomes a different instrument entirely. This is what happens when nursing overextends itself into clinical decision-making territory. He waves the pages like a prosecutor presenting evidence. For observations about post-operative swelling patterns. 6 separate notations about pain medication timing. 9 recommendations regarding hydration and antibiotic interactions. 9. From a registered nurse who is not a physician. The residents lean forward slightly, attentive to their superior's displeasure. This level of documentation, Caldwell continues, holding the chart at arm's length as though it carries an odor he finds offensive, represents exactly the kind of boundary confusion that gets patients hurt. Nurses observe. Physicians think. These are different skill sets. And when nurses begin to think, they can interpret clinical findings. He sets the chart down on the table with precision, right at the edge, where it could fall. Natalie's jaw doesn't clench. Her hands don't tremble. She has been trained in composure the way other people are trained in speech or walking. Her face shows nothing at all. Dr. Chen speaks up. Actually, the observations in that chart identified a potential interaction between the pediatric dosing and the boy's existing metabolic profile. 3 days before any of our consultants. Thank you, Dr. Chen, Caldwell says, not looking at her. We understand the perspective from the nursing staff. The emphasis on the last 2 words makes it clear that the nursing staff perspective is the perspective of someone who changes bedpans and takes orders. Not someone who makes decisions. Not someone who matters. The meeting ends at 9:31 a.m. Natalie walks to the vending machine in the break room on the 2nd floor because she's been awake for 18 hours and she needs coffee that tastes like regret. She feeds 5 quarters into the slot. A packet of instant espresso falls into the tray. She takes it out, and that's when Caldwell appears behind her like a man materialized from a thought. Playing doctor now, I hear, he says. He's close enough that she can smell his cologne, something expensive and aggressively masculine. His reflection appears in the vending machine's glass panel, but he's not looking at the machine. He's looking at her. He's looking at her the way predators look at animals that aren't yet frightened. I read charts, Dr. Caldwell, Natalie says. Her voice is quiet. It sounds meek. It sounds like the voice of a woman who made a choice early in her life to take up less space in the world. It's part of the job. You read charts and you interpret them. You make suggestions. You imply that physicians are missing things. He steps closer. That's not reading. That's overstepping. That's playing doctor because you couldn't hack real medicine. The vending machine hums its electronic hum. Somewhere down the hallway, a child cries. A monitor beeps in another room, announcing that some small heart is still beating. Natalie turns to face him. When she does, her hands are steady. Her breathing is steady. Her eyes are flat, like someone looking through a window instead of out of one. I was just getting coffee, she says. You know what I'm going to do. Caldwell's smile is the smile of a man who has never been refused. I'm going to have a conversation with hospital security about your involvement with the Morrison boy. About the boundary issues. And if I find that you've been in that room without a direct physician's order to observe, if I find that you've been performing any kind of assessment or, heaven forbid, communicating with the patient in ways that constitute medical decision-making. He pauses. The pause is calculated. Security will escort you from this building. Are we clear? Natalie pulls open the vending machine's paper tray with her free hand. The motion is smooth. The motion is precise. She takes the coffee packet out and closes the drawer. "Crystal," she says. He leaves. She stands in front of the vending machine for 7 seconds, and in those 7 seconds, something happens to her face that no one else sees. A flicker. A shadow. The ghost of something that lives very deep and very old and very patient. Then it's gone. Her expression settles back into the soft, competent, invisible mask she wears like skin. At 12:14 p.m., during her lunch break, Natalie sits in the corner of room 347 with her phone propped on her knee. Daniel is asleep. His breathing is even, relaxed in a way it hasn't been since he arrived. She's using her phone to learn ASL, fingers moving in small, careful practice motions in front of her face. The sign for good. The sign for safe. The sign for I'm here. Her hands move like they're remembering something. Like they're reaching for words that live in muscle memory instead of the brain. The video plays. A deaf instructor with silver hair teaches the sign for friend again. Tap your fist against your fist, side by side, like two hearts pressed together. Natalie's hands move through the shape, and she does it without looking at her hands. Muscle memory. There's a sound she doesn't register at first, the soft scrape of the doorframe behind her. A presence in the space. But she doesn't turn around because she already knows what's coming, and she's already decided not to give it power by acknowledging it early. And that's when the real nightmare began. The billing records didn't lie. Natalie discovered that on a Tuesday night at 11:13 p.m., sitting alone in the pediatric unit's cramped records room with the door locked and her phone set to silent. Cross-referencing surgical codes against insurance claims, she found the pattern. 17 procedures in 8 months. All children. All in Caldwell surgical rotation. All flagged by insurance algorithms as statistically improbable for their diagnoses. The file smelled like old paper and the faint chemical tang of document preservation. She photographed each page methodically, her hand steady, her breathing controlled, the kind of calm that comes from having already survived worse. 3 pages. $63,000 in inflated codes. A man named Marcus Chen, insurance adjuster, receiving regular payments that didn't appear in any official ledger she could access. But the patterns were there. The timing. The amounts. The way Caldwell's surgical requests aligned perfectly with Chen's approval windows. She uploaded the images to an encrypted server that didn't exist on any hospital network, then closed the files. Sat in the silence for exactly 90 seconds. Then stood, turned off the light, and walked back to the pediatric wing as if she'd only been refilling coffee. What she didn't account for was how quickly Caldwell would move once the threat became real. It started Wednesday morning with a call from someone at the Texas Board of Nursing. A routine credentialing review, they said. Nothing to worry about. Just some questions about her employment history. Natalie's chest remained level. Her voice remained steady. Of course. Happy to help. But she knew. Caldwell had reached out. Had made calls. Had activated the network he'd been building for years. By Thursday afternoon, Daniel's chart showed new orders in Caldwell's handwriting for antibiotics, broad spectrum, a cocktail designed to prevent post-surgical infection. Natalie pulled his mother's file. There it was, documented in 2015, penicillin allergy. And the genetic marker data from Daniel's cochlear implant screening, the same screening that flagged metabolic sensitivity to beta-lactams. She'd flagged it in her notes. Red text. Clear as a warning light on a runway. She found Caldwell in the pre-op area, his hands moving through the ritualistic wash, soap, water, the hiss of air from the automatic dispenser. 6 other people in the room. Good. Witnesses. Professional. Controlled. Dr. Caldwell, Daniel Morrison's chart shows antibiotic orders. His mother documented a penicillin allergy in 2015. And the genetic screening suggests. He didn't look up. His hands moved under the water like they'd done this 10,000 times before. I read the chart, Nurse Hayes. The antibiotics unnecessary. Post-surgical infection is the greater risk. But the genetic marker suggests sensitivity. His mother's history. Are you prescribing medication now? His voice cut clean as a scalpel. Because I can have your license reviewed by the board. Today. Right now. He turned, hands dripping, and looked directly at her. Is that what you want? The room went dead silent. One of the surgical techs looked away. Another pretended to adjust an instrument tray. Natalie's jaw muscles tightened imperceptibly. Her hands remained at her sides. No, doctor. Then I suggest you stick to what you're trained for. She walked back to the pediatric wing without responding, without defending herself, without the tremor in her hands showing until she'd closed the door to Daniel's room behind her. The trembling wasn't fear. It was restraint. The kind that keeps a person from doing something irreversible. She added one line to Daniel's chart in her careful handwriting. Asterisk allergy concern reiterated to attending physician 1,347 hours. Genetic sensitivity flagged. Recommendation declined. Asterisk documentation. Insurance. Proof that she'd tried. Friday morning, Caldwell made his move. 2 board members, both investors in his private surgery center in the Woodlands, received calls from his office. Routine credentialing conversation. Just wanted to flag some concerns about a staff nurse's involvement in clinical decision-making. Nothing serious. Just oversight. One of them happened to know the hospital's interim chief of compliance. A call was made. By noon, an outside investigator named Patricia Hollis arrived with a leather portfolio and the kind of calm that suggested she'd done this before. Many times. Caldwell had used her before. Natalie learned this by overhearing a conversation in the surgery lounge. Hollis's firm specialized in building termination cases. Airtight. Defensible. The kind that made lawsuits impossible because the documentation was too clean, too professional, too thorough to argue against. But what they didn't know was that Natalie's nursing credentials were real. Her degree was from Johns Hopkins. Her certifications were current. Her references were actual people. The problem was the other thing on her file, the classified assignment that Naval Intelligence had buried 2 layers deep in her personnel record. 6 months ago, a threat assessment had flagged Daniel Morrison as a potential vulnerability. General Jonathan Morrison, 2-star Marine General, Joint Operations Command, was high value enough that his son's safety required discreet monitoring. Natalie couldn't explain that. Couldn't defend herself by saying she was trained in emergency medicine, tactical field surgery, and 3 languages because the Marine Corps doesn't put that kind of person on a pediatric nursing floor by accident. Couldn't tell them she'd carried a bleeding captain 3 miles through Marja with mortar fire walking the grid around them, that the man's name was tattooed on her left forearm along with the date, Morrison, Captain J. Marja 2009. Couldn't say any of it without exposing an operation that went deeper than a hospital, wider than Houston, and had nothing to do with a doctor's greed. So she documented. Meticulously. Every interaction with Daniel. Every clinical concern. Every time Caldwell overrode her observations. Every flagged medication allergy he dismissed. She created a paper trail so detailed, so professional, and so thoroughly damning that anyone reading it would understand exactly what was happening, except nobody could explain why a pediatric nurse was documenting like a trauma surgeon, thinking like a military medic, moving through the hospital with the kind of situational awareness that made the actual doctors uncomfortable. By Sunday night, Caldwell had completed his second move. He'd contacted two of Natalie's previous employers, a clinic in Virginia, a brief stint at Bethesda Naval Medical Center, and suggested credentialing irregularities. Nothing specific. Just concerns. Just questions. Just enough to create the impression of a pattern. Patricia Hollis had taken these calls, filed them, and began building a timeline of inconsistencies in Natalie's professional history. The investigation was underway. Orderly. Professional. Designed to end her career without ever saying it explicitly. And that's when the phone rang. It was a Monday at 6:52 a.m. Natalie's personal cell. An unknown number from a 202 area code. She answered on the second ring, her voice automatic, trained. Hayes. Static. Then, Master Chief, this is Captain Andrea Reeves, Naval Intelligence, Pentagon. We have a situation. Natalie's blood pressure didn't spike. Her hand didn't shake. She simply closed her eyes and said what she'd known for 6 months might come. Daniel. A signal intercept suggests foreign assets have been tracking General Morrison's movement patterns. The boy's been flagged as a leverage point. We need you to. The voice paused. Are you compromised? Administratively. Yes. Hospital investigation. Should be concluded within 72 hours. We'll handle it. The line went quiet. Stay with the boy. That's an order. The dial tone hummed like a fluorescent light. She dressed, drove to St. Michael's, and found Caldwell in the surgery pre-op area again, preparing for a morning case. She didn't approach him. Didn't say anything. Just logged into the computer at the charge nurse station and began her charting for Daniel Morrison's 6:11 a.m. vitals check, her hands moving with the precision of someone who'd done this 1,000 times before, under fire, in the dark, with lives depending on accuracy. 2 hours later, Daniel's antibiotic drip hung at his bedside. The fall line was patent. The monitor showed his heart rate steady at 83 beats per minute, his oxygen saturation holding at 98% on room air. His small fingers moved in sign language, teaching Natalie a word she'd practiced all weekend. *friend. He signed it with his whole face, with his whole body, with the kind of joy that only children have. Natalie's jaw remained level. Her hands remained steady. She signed back, *friend*, and added one more line to his chart in her careful, meticulous, damning handwriting, *patient stable. Continuing current antibiotic regimen per physician order. Monitor for adverse reaction. She knew what was coming. Knew the timeline. Knew that within 72 hours, either the Pentagon would move, or St. Michael's would terminate her. She didn't know which one would hurt more. The antibiotic drip hung from its stand like a clear executioner's blade, the line running into the four-port tape to Daniel's small forearm. 9 o'clock exactly. Natalie logged the start time, 0900, in the medication administration record, her handwriting precise and unrushed, each number a small anchor in what would become the worst morning of her career. She'd reviewed his chart for times. Flagged the allergy twice. The notes were there in red, impossible to miss, penicillin class, severe reaction, anaphylaxis documented at age 6. But Caldwell had signed the order anyway. She'd watched him do it, his pen moving across the form with the confidence of a man who'd never been told no, who believed his authority was a shield against consequence. The medication dripped. Clear fluid into clear tubing, gravity doing its work, flowing toward the child's vein at a measured rate. 12 minutes in, Daniel was sleeping, his small chest rising and falling beneath cartoon hospital sheets. Natalie sat in the chair beside his bed, her eyes on the monitor, the green lines dancing in their reassuring pattern, oxygen saturation holding steady at 97%, heart rate 82. Normal. Safe. The lie we tell ourselves when we're waiting for something to break. By 9:23, Daniel's eyes opened. He didn't cry out. Deaf children learn early that sound doesn't carry weight in their world, so instead he clawed at his throat, his small fingers raking against skin with enough force to leave marks. His eyes found Natalie's, and she saw the confusion first, the not understanding, before it became terror. He was trying to swallow. Trying to breathe. The signs were small at first. A slight flush creeping up from his collarbone. A hand gesture she didn't immediately recognize as distress because it looked like scratching, just scratching, until it became clear that he couldn't stop. Natalie was on her feet before her conscious mind caught up. She reached for the call button, but she was already looking at his face, already reading the subtle swelling beginning at his lips, the way his jaw seemed heavier than it should be. Anaphylaxis moved like a thief in the dark, quiet, efficient, stealing oxygen one cell at a time. By 9:31, Daniel's upper lip had puffed to twice its normal size. The flesh around his eyes was beginning to swell, the delicate skin there turning pink, then red. His small hands flew in desperate patterns, signing something: help, pain, scared, the words fragmenting as panic hijacked his motor control. He was trying to tell her something, but his hands were shaking so badly the signs collapsed into noise. Natalie checked the foresight. No extravasation, no obvious problems there. The medication was doing exactly what Caldwell had ordered it to do, exactly what her flags had warned against. She pulled out her phone, fingers moving to call the charge nurse, when the monitor alarm cut through the quiet of the room like a scalpel. Not the gentle three-note chime of a disconnected lead. The urgent triple tone of desaturation. Oxygen saturation dropping. 94. 88. The numbers falling like a stone in a well. Natalie moved through the open door before the sound finished its second cycle. The pediatric wing of St. Michael's had a particular layout, rooms arranged in a careful grid, nursing station at the center like a hub, 3 nurses stationed there at this hour, 2 of them documenting, 1 on a phone call with pharmacy. She'd memorized every distance, every corner, every second saved by knowing where the code cart lived and how fast she could reach it. She didn't have to reach it. The crash cart was in the pediatric unit, stationed near the main elevators, maybe 40 steps from Daniel's room. But it might as well have been 40 floors away. She did the calculation her brain had learned to do in Marja, the mental arithmetic of mortality. Code team was 2 floors up in the ICU. Response time even with a rapid call, for minutes minimum. Daniel's oxygen was already bottoming out. His airway was closing. 3 minutes. Maybe less. She was back in his room, hands already moving with the kind of muscle memory that survives the 31 years since Marja, since the day her hands had known exactly what to do to keep a bleeding-out Marine alive in a kill zone where the only sound was machine gun fire and the medevac was minutes away that felt like hours. She pressed the code button on the wall, her finger leaving a small thumbprint on the plastic that would later be photographed by hospital security, and she spoke in the quiet voice of someone who has already made a decision that cannot be unmade. We have minutes. Maybe less. Daniel's eyes had gone glassy. The swelling was visible in real time now, his airway closing like a fist around his trachea. The monitor showed oxygen at 82. 80. The line was falling faster, his lungs fighting for air that was becoming harder and harder to pull through tissue that refused to cooperate. She reached for the crash cart, the physical one that lived outside the pediatric unit, not the metaphorical one that lived inside her muscle memory, and pulled it back to his room in 4 powerful strides. The metal wheel squeaked against the tile floor like something alive and frightened. Her hands found the equipment by touch. Pediatric airway management kit. Endotracheal tubes in sizes 3.5, 4.0, 4.5. Laryngoscope with a small curved blade. The intubation equipment was there, laid out with the kind of clinical precision that makes you realize the hospital had done this before, many times, a system built on the assumption that children sometimes choke on their own swollen tissues and someone has to know how to fix it. But intubation would take time. Time Daniel didn't have. His oxygen was 76 now. His lips were nearly unrecognizable, puffed and dark, the color beginning to shift toward the purple-gray that comes when the blood isn't carrying oxygen anymore. That's when Caldwell filled the doorway. He stopped there, frozen in the frame of the open door, watching his mistake materialize in real time in the body of an 8-year-old child. His face went white first, the particular white of a man who understands, in the same instant, both the immediate medical emergency and the long chain of liability it represented. He'd ordered the antibiotic. His signature was on the chart. The allergy flag was there in the notes, impossible to deny. What happened? His voice came out wrong, too high, too fast, the voice of someone whose professional armor had just cracked down the middle. Anaphylactic reaction. His airways closing. She said it in the automatic voice of a nurse reporting information, nothing in her tone suggesting the urgency that was moving through her body like a current. Her hands were already moving, already assessing, already calculating whether intubation would be possible or whether she'd have to go deeper, through the rigid rings of cartilage in his throat, through the membrane that separated the outside world from the last place you wanted to cut. She started, but Caldwell was already moving, not toward the crash cart but toward the wall where the phone lived, his hand reaching out like a man drowning. Wait for the code team. Don't do anything. That's an order. The words fell between them like stones. Daniel's oxygen hit 62. The monitor didn't beep anymore, it screamed, the alarm cycling through its most urgent pattern, the sound that every healthcare worker in the hospital was trained to respond to. Natalie could hear the commotion starting somewhere down the corridor, running footsteps, voices raising, the machinery of emergency beginning its slow assembly. But Daniel's lips were turning blue. Not the light blue of low saturation. The deep purple blue of brain tissue dying. Caldwell was in the doorway, phone in hand, speaking rapidly to someone on the other end of the line. His words were running together, code blue, pediatric, allergic reaction, don't know what happened yet, the narrative already being constructed, the story that would place blame somewhere downstream of his own decision. His eyes were on Natalie, waiting for her to obey, waiting for her to step back and let the system work the way systems were supposed to work, with proper protocols and proper authority and proper distance between the nurse and the doctor. Daniel's hand reached out, found Natalie's, squeezed once. She thought of Marja. She thought of Captain Morrison bleeding out in a ditch 3 miles from the nearest coalition base, the medevac 11 minutes away, her hands moving through the hemorrhage control protocols that had become muscle memory the way other people's hands remember piano scales. She thought of the choice that wasn't really a choice because the alternative was watching someone die when you had the knowledge to stop it. She didn't answer Caldwell. Didn't acknowledge the order. Her hand was already moving toward the airway kit, her fingers already sorting through the equipment with the kind of precision that comes from training so deep it lives below conscious thought. She pulled the pediatric airway management kit open, her movements economical and clean, nothing wasted. Get me a scalpel and the smallest endotracheal tube. Her voice had changed, dropped an octave, gained the kind of flat authority that leaves no room for discussion. And someone pull up his allergy protocol from pharmacy. Caldwell's face went from white to red in the space of 3 seconds. Nurse Hayes, I'm ordering you to step back and wait for. But Daniel's oxygen was now 58. And Natalie was already reaching for the scalpel. Her hands moved before her brain caught up. That was the problem with 15 years of muscle memory, it didn't wait for permission. The crash cart was 6 feet away. Natalie crossed it in 2 strides, her movement sharp and certain in a way that made the other nurses step back. She didn't ask for the emergency surgical kit. She grabbed it. The metal tray was warm from earlier use, the instruments arranged in precise order, scalpel, sutures, hemostats, forceps. Her fingers found the 14-gauge needle without looking. Daniel's oxygen was now 58. Caldwell was still talking. You are not authorized to perform that procedure. I will have your license. Security. I'm calling security right now. Natalie didn't hear him anymore. She never heard him. The world had narrowed to one thing, the 8-year-old boy whose throat was closing like a fist. She positioned Daniel's head back, her left hand steady on his forehead, her right hand palpating the cricothyroid membrane. The small boy's anatomy was different from an adult's, smaller space between the membrane and the cartilage, thinner skin, but the landmark was the same. She'd done this on a 19-year-old Lance Corporal named Chen in Marja, 2009, with explosions walking across the compound like thunder. She'd done it on a 43-year-old gunnery sergeant in a landing craft when the medic froze. She'd done it 17 times, and her hands remembered every single one. One horizontal incision. Clean. No hesitation. The scalpel moved through skin and the cricothyroid membrane with the precision of a surgeon who'd trained for 15 years in civilian medicine and learned the real lessons in combat zones. Blood welled, but not catastrophically. She'd avoided the anterior laryngeal artery. Daniel's body convulsed slightly, a reflex, but he was already dying. No airway. No oxygen. No time for textbook protocols or Caldwell's liability concerns. She grabbed a pen from her pocket, a Pilot G2, standard issue, the kind every nurse carried. She'd done this calculation before: pen barrel diameter, airway diameter, emergency, no other options. She broke the pen in half, leaving the barrel intact. The plastic was smooth. Cool. Emergency cricothyrotomy tube. Field expedient. Not sterile. Not protocol. Not going to matter if the child was dead. She inserted the barrel into the opening she'd created, pushing gently through the membrane until it was seated. The angle was critical. Too shallow and it wouldn't work. Too deep and she'd penetrate into the trachea. Too far, miss the airway entirely. Daniel gasped. It was a horrible sound, a sucking, terrible inhalation through a makeshift airway, the sound of a body remembering how to breathe. His small chest rose. His back arched. His eyes opened wide, searching for air and finding it, finding life. The code team rounded the corner 5 seconds later, moving fast, calling out vitals and medications and running through protocols that Natalie had already bypassed entirely. Daniel was breathing. His oxygen was climbing. 62. 65. His color was already better. Caldwell was on his phone before the code team even reached the bedside. His voice was tight, controlled, the voice of a man who understood that something had just gone catastrophically wrong for his plans. I need security in pediatrics immediately. And get me the hospital administrator. Now. Natalie stepped back from the bed with the same calm she'd shown after carrying Captain Morrison 3 miles through enemy fire. Her hands were steady. Her breathing was level. The trembling wasn't fear. It was restraint. It was the specific kind of control that comes from having already survived the worst and lived to explain it to people who would never understand. The next morning, she sat in the hospital's main conference room while Caldwell built his case. The room smelled like stale coffee and the particular fear that comes before power plays, sharp, acrid, like someone had been sweating through cologne. Miss Hayes, Peterson began, the hospital administrator whose entire tenure had been defined by avoiding controversy, performed an unauthorized invasive surgical procedure on a pediatric patient without attending physician approval or surgical clearance. This constitutes a severe violation of our scope of practice protocols and creates extraordinary liability exposure. Caldwell opened a folder. Inside were documents Natalie had never seen before. Fabricated disciplinary reports. An email flagged as unprofessional communication, but it was her handwriting, her words, and she'd never sent it. Credential irregularities. Complaints from other nurses claiming she'd been insubordinate. He'd built it all in the 12 hours since she'd saved Daniel's life. I've contacted her previous employers, Caldwell continued, his voice smooth as oil. There are several gaps in her employment history. Unexplained absences. Reassignments that suggest performance issues. He couldn't say the truth, that those gaps were classified. That those assignments were ordered by naval intelligence. That everything about Natalie Hayes that mattered couldn't be discussed in a room full of civilians and billing administrators. 2 board members nodded along. Both of them had invested in Caldwell Surgery Center in Nevada. Both of them understood what happened to money when liability lawsuits were filed. An outside compliance investigator, someone Caldwell had apparently worked with before, was flying in from Austin tomorrow morning. The fix was already in motion. Natalie sat in a plastic chair and didn't defend herself. Couldn't defend herself. The truth was classified. Her service record was classified. The assignment that had brought her to St. Michael's Hospital to monitor the Marine General's deaf son after a threat assessment flagged potential targeting, that was classified too. She nodded once when Peterson told her she was on administrative leave, effective immediately, pending investigation. She accepted the security escort with her hands folded in her lap. She didn't say a word when Williams, the hospital's head of security, a retired Marine gunnery sergeant who'd suddenly gone very pale, offered to let her leave through the back entrance instead. "I'll take the front," she said quietly. "Thank you, gunnery sergeant." His eyes went hard when she used his rank. He knew. Didn't know what he knew, but he knew something had shifted in the air of that room. At 2:17 in the afternoon, Natalie sat at her kitchen table in her scrubs, still wearing her badge, still wearing the name tape that said Hayes in white letters on dark blue fabric. The afternoon light was weak through the window. Outside, Houston was conducting its ordinary business, traffic, construction noise, the distant sound of a lawnmower. Inside, she was falling apart. Her shoulders shook. Not from fear. From rage. From the specific, controlled fury of someone who'd spent 15 years following rules and been punished for saving a child's life. Her hands pressed against her eyes, and she realized her hands were shaking. The trembling wasn't fear. It was restraint breaking. Marcus came through the door at 3:53 p.m., his backpack over one shoulder, his 14-year-old face still carrying the last edges of childhood. He dropped the backpack on the tile. Stopped. His mother was crying at the kitchen table. "Mom." His voice was different suddenly, older, smaller, the voice of a kid who'd never seen his mother cry before. Not once. Not when he was 7 and broke his arm. Not when his father was deployed. Not when she worked double shifts and came home with blood under her fingernails. "Why are you home?" Natalie couldn't look at him. Couldn't explain what she'd done or what it had cost or why the world punished people for being exactly who they needed to be in the moment it mattered most. They. "Mom. I can't tell you what happened, baby." Her voice broke. She hated that. Hated the break in her voice. Hated that Marcus was standing there watching his mother fall apart in their kitchen at 3 in the afternoon. "I can't. You know I can't. But I need you to understand that I didn't do anything wrong. I never do anything wrong. And it doesn't matter." Marcus set his backpack down slowly. He didn't approach her. Didn't try to comfort her. Just watched. Just waited. The way children do when they're trying to understand how the world actually works and discovering that it works on cruelty and politics and systems designed to protect people who didn't save lives that afternoon. "Is it the hospital?" he asked quietly. "I can't." "It's the hospital." "And the doctor?" He wasn't asking anymore. He was 13 years old and already smarter than the systems that surrounded them both. "The one you said was doing something wrong." Natalie looked at her son. Looked at his face, still soft with youth, still believing in fairness because his mother had taught him fairness was real. She wanted to explain everything. Wanted to tell him about Marja and Captain Morrison and the reason they'd moved to Houston and the classified assignment that had brought them to St. Michael's Hospital in the first place. Instead she just nodded. "He's going to get away with it," Marcus said. "Not a question." "Yes." "That's not fair." "No," Natalie said. "It's not." Marcus walked to the refrigerator. He pulled out 2 bottles of water and sat down across from his mother. He didn't say anything else. Just sat with her while she cried at the kitchen table in her scrubs at 3 o'clock on a Tuesday afternoon, everything she'd worked for burning down behind her like a building made of paper. Neither of them knew that the shadow box was coming. Neither of them knew that inside 48 hours, everything would change. But that afternoon, sitting across from her son in the weak Houston light, Natalie Hayes, Master Chief Petty Officer, Combat Medic, Marine, Mother, accepted that sometimes you save a life and lose everything for it. Sometimes the world doesn't recognize what you've given. Sometimes the people you've carried through hell don't remember your face. That was the real emergency. That was the airway that nobody could open. 2 days of silence. 2 days of sitting in her kitchen watching her son Marcus avoid her eyes while he moved through the house like a ghost. 2 days of her phone dark, her inbox emptied by hospital IT as they scrubbed her access. 2 days of knowing that somewhere in St. Michael's, in a wood-paneled conference room on the 3rd floor, Dr. Marcus Caldwell was preparing to erase her. The board meeting begins at 10 a.m. on a Thursday. Natalie's not there. She's not invited. Caldwell has made sure of that, packing the conference room with the 2 board members who invested in his surgery center, with the compliance investigator he'd hired, with documentation of unauthorized medical procedures and gross violations of hospital hierarchy. His case file sits thick on the mahogany table, a fortress built from panic and precision. Peterson, the board chairman, reviews the materials with the steady expression of a man reviewing a firing that's already decided. The security chief, a retired Marine gunnery sergeant named Williams, stands by the door as protocol. Everything about this moment feels final, feels sealed. Caldwell sits across from Peterson, composed now, having rehearsed his explanation. An emergency procedure, yes, but it violated every chain of command. A nurse, just a nurse, assuming the authority of a surgeon. The liability exposure alone justifies immediate termination. But that wasn't the worst part. The conference room doors swing open at 10:51 a.m. Not a nurse. Not an administrator. A 14-year-old boy in a school uniform carrying a shadow box. Behind him, stepping through like gravity itself had just reversed, stands General Marcus Morrison, 3rd Marine Expeditionary Force. Full dress uniform. Chest covered in ribbons. His presence makes the air pressure change, the way it does in rooms where real power walks through doors. Marcus, Natalie's son, holds the shadow box steady. His hands are trembling, but his voice is stone. You need to see these. The shadow box opens. Inside, a Navy cross. 2 purple hearts. A Master Chief Petty Officer insignia, the rank insignia catching light like a promise made in blood. Peterson stops breathing. Williams straightens. Caldwell's jaw tightens. What is this? How did you? But Morrison steps forward, his voice like a tank idling in a garage, low and capable of everything. He points to the Navy cross with one finger. The nickname engraved there, Ghost. That's Master Chief Petty Officer Natalie Hayes, Morrison says. His voice fractures on her name. That's the woman your chief of surgery just tried to fire. The room goes still in a way that feels like a held breath before lightning strikes. Morrison pulls his left sleeve up. The tattoo beneath is faded but perfect, the letters dark against skin weathered by sun and time and things that leave scars you can't see. Natalie Hayes, MCPO, Marja 2009. He holds his arm there, making sure every person in the room commits the image to memory. Marja, 2009, Morrison continues, his voice steady now, the way military men's voices become when they're telling the truth that matters. I was captain then. Took a round through the right thorax. Sucking chest wound. Lost 2 liters of blood crossing the kill zone. He pauses. Each sentence deliberate. Natalie carried me 3 miles through enemy fire while calling in medevac coordinates. Performed emergency cardiac access on the bird using field supplies and a flashlight. I was dead. Twice. She brought me back both times. Caldwell's face drains of color. Not from shame. From understanding. Peterson's hands have gone white where they grip the table. General Morrison, I'm not finished. Morrison's eyes stay on Caldwell. That night, I had 17 surgeries. 17. I lived because of combat medical training most trauma surgeons never get. Natalie has that training. She's also got a Master Chief's rating in emergency medicine, 23 years of Navy Medical Corps experience, and the kind of composure under pressure that gets people home alive. Morrison sets the shadow box down with ceremony, the kind of gesture that turns objects into monuments. And you put her in a pediatric ward and made her hide it. The silence tastes like copper. And then the doors open again. This time it's Daniel Morrison, 8 years old, moving in that careful way children do when they've learned hospitals mean pain. His cochlear implants are visible, still healing, still new. But his eyes are clear. He walks straight to Natalie's empty chair and places something on the seat. Combat boots. Worn. Caked with dust that looks like it came from another continent, another lifetime. The dust of Marja, still there, preserved like evidence. Daniel's small hands move in ASL, precise, learned by his father in hospitals during recovery, learned by his father's nurses, learned by every person who's ever loved someone who couldn't hear. Thank you. For saving my dad. Thank you. For saving me. The words hang in the air, made visible by a child's hands, made permanent by gratitude. Williams moves from his position by the door. Not threateningly. Respectfully. He stands at attention, and his voice when it comes is the parade ground voice, the voice that ends conversations. Master Chief Petty Officer on deck. Every person in that room, whether they know the protocol or not, understands what they're witnessing. The civilian clothes fall away. The shadow box becomes something holy. The boots become something sacred. This isn't a termination meeting anymore. This is a court of record. Caldwell stands. A mistake. He should have stayed seated. This is irrelevant to the unauthorized procedure. Regardless of her background, she violated. Sit down, Peterson says quietly. I'm the chief of surgery, and I have the authority. Sit down. Peterson's voice carries the weight of someone who's just watched his entire institution be held accountable by a general and a child and a pair of dusty boots. Williams has moved to the door. Not blocking escape anymore. Making sure no one leaves before this finishes. Caldwell notices. His hands begin to shake. Morrison picks up the shadow box again. His voice, when he speaks, is the kind of voice that changes testimony, that stops wars, that makes history by simply telling it. I'm going to read her citation. The one you tried to erase by hiding her assignment here. He opens the box, retrieves the Navy Cross. The hallway is silent enough to hear the fluorescent lights hum. For extraordinary heroism in combat operations, Marja District, Helmand Province, 2009. While assigned to Combat Surgical Team 4, Master Chief Petty Officer Hayes identified a casualty requiring emergency intervention. While under active enemy fire, she performed open cardiac massage through a left anterolateral thoracotomy with field supplies, established tension pneumothorax management, and maintained patient airway control for 3 kilometers across active kill zones while simultaneously directing air support coordinates to incoming medevac assets. Her actions directly saved 3 combat lives and prevented loss of critical intelligence assets. She is hereby awarded the Navy Cross in recognition of bravery, composure, and extraordinary medical capability. He lowers the citation. His eyes are wet now, and he makes no effort to hide it. A Marine general crying over the moment his life, and his son's life, is finally visible. Caldwell tries the door. Williams doesn't move. The panic is starting to show now, cracks in the composure he'd maintained for days. This is all very moving, but it doesn't change the fact that Peterson's phone rings. He glances at the screen, and his face does something that reminds you why some men rise to positions of authority. He answers. Listens. Hands the phone to Williams. Williams listens, nods, and replaces the receiver. When he speaks, it's to Caldwell. Sir, we need you to remain seated. I don't understand. The doors open. 2 federal agents. Torres, the lead, badge already out. She's got the look of someone who spent 3 days building a case and 2 hours watching surveillance footage. Dr. Marcus Caldwell. His face goes the color of old medical tape. We need to discuss why you accessed and attempted to alter classified personnel files at 11:16 p.m. last night. Torres steps closer, methodical. Specifically, Master Chief Petty Officer Hayes' Navy Intelligence Assignment documentation. That access triggered automatic federal alerts. Your deletion attempts at midnight made this a federal crime. Caldwell stands. Tries to move toward the door. Williams is there, a wall in a security uniform, impassable as stone. The second agent moves to his other side. There's nowhere to go. There's nowhere to run from the moment you've been caught destroying evidence of your own guilt. I have the right to, Caldwell starts. You do, Torres says. She's pulling handcuffs now, the movement smooth and practiced. You have the right to remain silent. Anything you say can and will be used against you in federal court. You're being charged with tampering with classified records, attempted fraud, and conspiracy related to unlawful medical billing practices. You have the right to an attorney. The perp walk happens at 3:15 p.m., past the nurse's station where every nurse who's ever been humiliated by him stops working and watches. He's in handcuffs, federal agents on either side, and his face is the color of someone watching their entire life get loaded into a patrol car. Channel 7 News is already in the lobby, cameras rolling, because someone, probably Peterson, made a call. The footage will air at 6. By midnight, the Texas Medical Board will have revoked his surgical privileges. By morning, every hospital in Texas will have flagged him. By afternoon, he's nothing. By evening, he's less than nothing. By the next week, he's a cautionary tale whispered in medical school lectures. But all that is later. Right now, in the conference room, General Morrison is signing his daughter, who's been watching Natalie's back, a thank you sign that his small son learned by watching his father survive. And Peterson is making calls. And Williams is explaining to the other board members that they were invested in a criminal. And Torres is reading Dr. Caldwell his rights as the federal case against St. Michael's Surgical Department unfolds like a planned building demolition. The boot dust from Marja sits on a chair. A reminder. 6 months later, a Marine general is driving through a strip mall in northwest Houston when he spots something that stops him at a red light. There, between a tax preparation office and a vape shop, sits a folding table. And behind that table, in a rumpled polo shirt the color of surrender, sits Dr. Marcus Caldwell. Selling supplemental insurance policies to elderly couples who look uncertain. A banner above reads supplemental insurance policies in faded letters. He's talking fast, the way people do when they're desperate, when they're trying to convince themselves as much as anyone else that this job, this table, this strip mall means something. Morrison watches for 30 seconds. Then he drives on. He doesn't need to watch longer. Justice doesn't always look like courtrooms. Sometimes it looks like this, a man selling insurance from a folding table, alone, while the person he tried to destroy is somewhere becoming legendary. That same afternoon, Natalie stands on a stage in San Diego under military lights that make everything look like it matters because it does. The Navy Medicine Leadership Ceremony Auditorium holds 400 people, most of them medical officers, some of them Navy SEALs, all of them standing because of what's about to happen. An admiral approaches her in her dress uniform, shoulder board showing her new rank, Chief Nurse Corps, Pacific Fleet. The citation is read aloud, 19 paragraphs of documented excellence and service and the 17 families who received settlements because of her meticulous charting, because of her refusal to look away. Daniel Morrison stands beside her in dress clothes that fit him perfectly now, his cochlear implants finally healed, fully functional, his hands ready to interpret because his father taught him that some words matter too much to be spoken alone. His hands need to translate them into visibility, into permanence, into truth. As the Admiral's words fill the auditorium, Daniel's hands move in perfect rhythm. Heroic. Service. 18 years. His movements are fluid and precise, the kind of grace that comes from practicing something that matters. Every word his father's hands shape in the air becomes something the deaf community and the hearing community witness together, made visible at the same moment, understood by everyone. When the Admiral pins the new insignia on her collar, the auditorium rises in applause. Not the polite kind. The kind that sounds like gratitude made into sound, like recognition that comes too late but arrives anyway. Marcus sits in the front row next to General Morrison, and his face is the face of a son who watched his mother be erased and is now watching her be remembered. General Morrison stands with his phone recording, his left forearm visible, the tattoo showing, Natalie Hayes, MCPO, Marja 2009, made visible for history. Daniel looks at Natalie and signs a question, "What do you want to tell everyone?" She steps to the microphone. Her voice, when it comes, is the voice of someone who's been quiet for too long but speaks now with absolute certainty. Each word deliberate, each sentence shaped for Daniel's hands to catch and hold and translate into light. True heroism is what you do when the world stops watching. The auditorium goes completely still. Daniel's hands move, shaping the words in the air, making them visible, making them permanent, making them something more than words. His hands move like they're sculpting truth out of empty space. True heroism. World stops watching. The applause, when it comes, sounds like recognition finally made whole. General Morrison's eyes are wet again, and this time there's no hesitation, no hiding it. His son has a mother who's a legend. His daughter has a father who remembers. And Natalie Hayes, Master Chief Petty Officer, has finally been seen. Like and subscribe if you love stories about people who've been underestimated. Comment below if you've ever had someone doubt you and you proved them wrong. Let's get back to it.